Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're talking about exercise routines for cancer patients. Is it recommended for cancer patients to exercise?
Exercise can be very helpful for cancer patients depending on the timing of their cancer treatments and the type of cancer that they have. We often recommend prehabilitation exercises or exercises before surgery, chemotherapy, or radiation to help with the outcomes after that intervention. During active treatment, it can be harder to exercise. Most patients are tired and can feel sick to their stomach. We do offer exercises for those patients as well, but they're more tailored to the needs of the patient at that time. Radiation is another time we really focus on the specific needs of the patient. Positioning for breast radiation is actually this position with the arm back and up above the head, and you can imagine that would be very difficult for a patient with a shoulder problem. So depending on the situation of the patient, their current joint pain and joint issues, and the type of cancer and the type of cancer treatment that's recommended will really tailor an exercise program to their needs.
How does exercise help cancer patients?
Exercise can be helpful for pain, weakness, trouble walking, trouble with balance, trouble breathing, trouble going to the bathroom, things we don't even want to talk about. There are so many things that exercise can be helpful for. However, in cancer patients, we really want to worry about their other issues, and in the event of a fracture from the cancer or another issue that needs to be treated, we want to make sure that we're not only helping the patient with their issue, but also not doing anything that would affect their cancer treatment.
When do you suggest a cancer patient begin an exercise program?
An exercise program really is tailored to the patient's needs, and it depends on what the patient's impairment is and the timing of their cancer treatment. We always want to make the cancer treatment paramount and work around that. I've had several patients that have had to stay still for radiation, and that can be difficult to stay still in a position that's uncomfortable for them. So depending on whether that radiation is of the upper body or of the lower body, we'll work on specific exercises tailored to get comfortable in the position that that radiation is going to occur for that particular patient.
What makes for an effective exercise program?
An effective exercise program is one that makes the patient feel better. You know, we often think of pain or weakness being treated by exercise, but even sometimes trouble breathing or trouble going to the bathroom, things we don't want to talk about, those things can improve with exercise.
What is your recommended duration for exercise?
Patients before cancer treatment or after cancer treatment will recommend daily exercises. During active treatment, especially if it's chemotherapy, it can be very difficult for patients to exercise daily. So it depends on the fatigue and the energy level of the patient, how often their exercises will need to occur.
Are there any limitations for cancer patients when it comes to exercise?
Depending on the location and the extent of the cancer, it can be harder for patients to exercise, and if they have a fracture from the cancer, it can be less safe for the patients to exercise. We really want to tailor the exercise program to their needs and to any other problems they're having in their body, either as a result of the cancer or their other medical problems.
Are there any exercises to avoid?
Yes, it really depends on the type of cancer. So for example, for my breast cancer patients, I'll typically focus on the shoulder because that's close to the area of the intervention, and it's usually where patients have their problem. For my lung cancer patients, I'll often focus on aerobic exercise because that can be helpful with the function of the lungs and improving that function after surgery. For my sarcoma or melanoma patients, we focus on the area where they have the surgery, where they have the cancer taken out, getting those tissues healthy and protecting that area within the restrictions recommended by the surgeon.